Happy Sunday, everyone. Back again. Today, this is JD Tyler with us. This is Dr. Elsie Coe with Lead Physician. I'm so happy to have him today. Hi, JD.
Hi, how you doing?
Good. Let me just introduce you, JD. JD is the former CMO of Tissue Analytics in Kansas City, Missouri. He is now working full-time as the CEO and founder of Just Ask Evie. Just Ask Evie. Very interesting, very innovative solution to problems we have with the IT systems. He's highly skilled in the IT and service industry, which includes the IP and sales. JD, thank you so much for being here today. Can you tell us about what this is, what platform you've developed, and how is this going to help us?
Sure. So Just Ask Evie in its simplest form is really an Uber for EMR support, basically. So what we've created is a web-based platform that allows physicians and now nurses and anyone else involved with the EHR at a health system to have instant access to a network of peers who have or are super users of that same EMR. So for example, if it's 2 a.m. and you're an ER doctor and you can't close your note for whatever reason, you've just learned this new EMR, your system put it in, but there's no one around to help you, you just ask Evie. You hit the button and within seconds, someone will call you back who is a fellow physician who has gone through exactly what you've gone through, and they can help you get unstuck and you can get back to seeing patients. It's
Uh,
all done through web-based. We do a screen share that is HIPAA compliant, and the phone call is peer-to-peer as well.
well, how is that different from any other solutions there are to screen share? I reached out to our IT department and they said, well, we have solutions for that. We can do that.
They're absolutely right, but what we do with our software is we tie everything together. So it's very, very easy to use. So the physician or nurse, whoever, literally hits a button or smartphone or on the desktop, and everything's taken care of in the background. We have this matching algorithm that says, oh, you're a physician. I'm going to route your request over to whoever answers physicians, either internally, but if it's after hours, it will be sent to one of our physicians. Same thing for a nurse. So we kind of tie all those little pieces together and put it in a nice little, put a bow around it for you. And we really focused on kind of the front end, all of the development that's been done when it comes to, IT support has really been focused on the IT side, not really on the clinical or the person asking the question. And I've looked back and, they have great ticketing systems now. And as you said, they can do a screen share, they can remote in, but no one's really thought about the process of, well, how do you get to that point? And, is it a good experience for them? Do they actually want to use it? The traditional call the help desk. People really call the help desk really only when they absolutely have to, or when they're really mad. And so we wanted to kind of really focus on the front part of like, okay, you're stuck, hit a button, we'll make a great experience. Just like you do with Uber or Lyft. You just simply
Right.
hit the button, someone shows up, they know where to take you, and you control your experience. You can say, I like the car cold, I want this kind of music. For us, it's kind of, it's a peer-to-peer. So they speak the same language that the physician or the nurse or anyone, or even registration, that they can actually communicate with. So that's probably the biggest difference. We focus on the front end and everything, and then also the back end, but primarily focusing on the front end, that experience right there.
I think you brought a really good point. You said you're really thinking about the user, and IT
Yeah.
has kind of been separate from, the clinicians or the healthcare providers who are the ones who have to use it. And because we kind of threw into the whole system this whole requirement of having EHRs, I think prematurely, I don't know what you think, to the point where we weren't really able to design it that to make it user friendly. So I
Absolutely.
agree with you. I hear you. I wish I had that. I just it wasn't that long ago that I was trying to onboard onto an EMR system and was talking to somebody over a phone, describing what they were seeing on their screen to tell me what button I need to hit to do the next thing. And I wanted to pull my hair out.
Yeah, no, that's your experience, as was my experience over and over again, from as a resident in training to a hospitalist in practice, and even jumping over to the healthcare IT side, just seeing, large and small organizations struggle with, as you said, improving their own EMR, upgrading their EMR, because it's not done. It's not user friendly right now. It's on that trajectory to do that eventually. But in the right now, those projects are really cumbersome. Getting support for an upgrade at your or an optimization project at your health system, it's a tough thing because you have to do a lot of build, a lot of time spent. And then when you actually go live, you have to train the physician on something new. You have to support them. It's a cumbersome process. And I've experienced that from every role I had. And I thought to myself, there has to be a better way. It's so expensive now to, pay for at the elbow support or pay for a third party. And it doesn't need to be. I thought to myself, when I was on site or at literally at a physician's elbow, I could see them struggling. I would help right then and there, and
Mhm.
the feedback was always the same, like, wow, you just saved me a bunch of time. Thanks so much. And I heard that enough to where I thought there's got to be a way to fix this with technology to where we can, because they want to hear from a super user that's also a peer. How do we get those two together? And so that's really how it started. It was just kind of an idea. I call it, scratching my own itch,
Mhm.
and it's what led me over to healthcare IT to begin with. And it started just really as, at the virtual at the elbow support to supplement a health system that was either doing an upgrade or they're doing a go live. And that's
So
what we
you know what?
started
Let me
as.
stop you there for a second, Judy, before you go into how you started, because I would love to hear that. But I want to know, who is that person on the other end of the phone?
Yeah.
Is it our own IT people, or is it someone outside that you've hired for your company that someone has to sign up for?
Well, since the pandemic, it can now be both. So
Okay.
we initially just started as saying, all right, it's going to go to one of our physicians, and those physicians and nurses are U.S. trained physicians, U.S. trained nurses who have really kind of been a part of IT projects at their own facility. And the way we have it structured, they have complete control and flexibility over how often they want to help. And so just like an Uber or Lyft, they just kind of opt in and say, I'm available now. I can answer questions. We always onboard those particular physicians and nurses
Mhm.
with the particular build of that system that they can answer questions for.
Mhm.
And so that's how we kind of have it supported. But since the
Which
pandemic,
which systems are you talking about? Epic?
Epic, Cerner, McKesson, Allscripts, a bunch of little niche EMRs. I
Wow.
spent about almost a year just building the network of people who are Epic certified or Cerner super users, and just build that network of people who are like really interested. Like, yeah, this is something I normally do for my own facility. I don't want to travel to do it. And I'm like, you just travel to your couch. It's you do it virtually,
That's
and I will reimburse you for everything that you do. So you're helping your fellow physician or fellow nurse, and you're getting compensated for your time as well.
right. So they can call it at 2 a.m.
Yep, they can call it two. We have had calls at 2 a.m. and they have been answered.
Wow, that's incredible.
Yep.
But you said
You
you
have
can
to
use
think.
your own IT system support people.
I'm sorry.
You can use your own IT support people.
Yes, that's what, as I mentioned earlier, that's where the pandemic kind of opened our eyes to offering Just Ask Evie as a software as a service. As you kind of mentioned, well, the IT team says, well, we already have Microsoft Teams, and it's like, yeah, understand that. What we do is we incorporate that Microsoft Teams into our software and say you can still use everything the same. It's just now that the front end, where the
Right.
person who needs help, they simply hit a button. Everything's taken care of in the background and sent to you automatically. So it makes the most of their actual IT team themselves. So they can, in a way, cut down their help desk volume
Right.
by offering this button to certain groups of physicians or nurses or whatever teams they want to at their healthcare system, and be able to just automatically triage that to the right person. And we even set up parameters on our software to say, hey, if you want us to cover nights and weekends for your physicians and nurses, not a problem. Tell us when you want us to start covering. So if they say at 5 o'clock, everyone from our staff goes home, we say at 5:01, any question that comes in comes directly to one of our staff. That way, the next day when the IT team gets there, they don't have a long ticket or a long list of in their queue of people who called in or voicemail they have to check. They simply have a report from us saying, here's all the questions that were asked last night. Here's who asked them, and here's how they were answered, because we're completely transparent with it. So we even have a real-time dashboard so they can figure out, even when they're using
Wow.
their software, what are their peak volumes? Who's calling? Who's asking questions? That feedback loop is vital so they can figure out how to staff their own team. They can figure out how to improve their onboarding and their training, and they can find out little glitches and bugs in their own EMR. because the physicians who call in and they're talking to a fellow physician or even nurse to nurse, they're much more open to us than they are to their own IT staff, because they just say, hey, why does it work this way? Why do I get this error every single time I do this? We report that back to the health system. Health system didn't even know about it. They're like, we can fix that. We had no idea it was an issue. But that communication is just not existing there. So what we provide is that we bridge that communication. We give that feedback loop. So there's a lot of little things that we can do that really improve the EHR overall.
That's amazing. I love that. What's the wait time from the time I hit a button because I need help to getting somebody to help me?
It's usually less than 30 seconds. So
Wow.
how it's set up, nobody is tethered to a computer. It's all via push notification or text message. And so when you hit that button, it goes to a pool of people, for example, let's say 5, 10 people, and it says, Elsie has a question. Okay. If just because you're not in front of your computer, but you're on your way to the computer or you're nearby, you can look at the text message and reply with the PIN number that's in the text message. And then that will match you along with the IT support person. And then as a confirmation text, it sends back your phone number and says, here's Elsie's phone number, give her a call. And so they hit from their phone, they call you back and they're saying, hey, Elsie, I understand you have a question, as they're walking to the computer. And you say, yeah, I do. Okay, I need to see your screen for this. And so on your screen, you just simply click this giant icon that says click here to share screen. We made it very user-friendly, very obvious. And so that launches into that, third-party screen sharing service like a Microsoft Teams or WebEx,
The
and you're
HIPAA
able to share your
compliant, right?
screen.
HIPAA
Yeah,
compliant.
yep. So we always honor whatever the organization uses. That way we
Okay.
just we stick to what they're comfortable with. We
Right.
really focus on on the user experience, both the front end as well as, I've been in healthcare IT long enough to know how much red tape is involved, how long projects take when you have to, go through a vetting process. And so we've made it web-based, it's EMR agnostic, and we built it to where it can be scaled as small or as large and as quickly as possible.
Okay. Thank you so much, JD. Let's just
Yeah.
backtrack because what I'm really interested in. This is a forum for physician leaders. How did you? Now let's go back and how did you get this idea in your mind, and what kind of support did you have along the way to become this leader of this company that's so innovative? What made you think outside the box and grow something like this? Did you have business skills? Did you have to learn outside of training? Did you get training in school?
No, I took one business course in college, and that was it. And if you don't count business calc, because I couldn't get into regular calculus because it was full, so I needed a business calc. So if you don't count that, no business experience other than just kind of common sense of managing my money, understanding that the difference between a charity and a company. But I would say what started it was just kind of similar to what led me over to healthcare IT. I live here in Kansas City, as you mentioned, and there's a large EHR vendor here in town, and I was using it every day, and it was my bottleneck. And I thought to myself, do they even talk to physicians to see if this thing can be improved and how understand how we think, how this is additional work for me. I want it to help me work, and that led me over there to to be a physician lead for about 7.5 years on the development side, and that was all
Wow.
because I thought to myself, I can continue to complain about this, or I could do something about it. And so I decided to do something about it. Is the same thing with this, as I was a CMIO, an interim CMIO at a health system that had already pushed their go live once, and they were in threat to do it again. And so I was hired on to kind of help course correct and get them on time. And I know that system inside and out, and I helped rebuild it and help hold the implementation in the ER, clinics, hospital, everything. And the go live was still a struggle, and it was because of the support. The quality of the
Oh,
support wasn't as good. Some of them were clinicians, some weren't, some were pretty new. It was all over the place. And I thought to myself, there has to be a better way. And so I think once I've, experienced something and understand exactly how it works, it's just my nature to say, why does it have to work that way? Can it be better? And that's probably what, and led me down the path of, hey, why do we have to have true elbow support people? Like fly them there, pay for their per diem, pay for their lodging. That's so expensive. And
right.
logistically, they can't help as many people as they should be helping because they're walking around everywhere. Why is this an opportunity for some virtual service? And that's what led me to the idea. And then and initially the first pilot, I just wanted to see if it would work. And then if it wouldn't work, then I was just going to say I tried, but we're not there yet. But it worked. It worked great.
Wow. So who's using this now? Who are your customers?
So right now, we have some customers in the local area, like Lawrence Memorial, that are using it as a software as a service. There's a home health organization down in Oklahoma that's using it as well. But we helped Einstein Medical Center, up in Philadelphia. They had an ER optimization project. We helped with that optimization project. That was about 180-ish physicians that we supported. And then during the pandemic, we helped a clinic out on the West Coast, out in the Seattle area for Evergreen Health, helped them with their go live. So they had acquired a clinic, all this prior to the pandemic, of course, but they were set to go live during it. They thought to themselves, how do we pull this off? We can't have anybody here because of social
This comes at a
distancing.
perfect time, JD.
Yeah, it was one of those things to where they're like, well, hold on, they were actually our pilot site. They said, well, it's a small clinic, so we thought we could get away with not needing like a virtual service, but we had a really good experience with Just Ask Evie, so let's just see if we can do that. So they went down our path, and we still get calls from them. Their go live was, what is this now? It was probably 8 months ago. And we still get calls because people forget stuff. They'll get stuck in the clinic and they'll say, hey, I got this note forwarded from this student. I don't know what's going on with it, and share their screen, answer the question, and they're ecstatic. They're like, okay, I'm no longer stuck in the clinic tonight. I can go home.
Let me ask you something. You can't just be successful with the knowledge that you have and the tools that you have. You have a team of people that you're recruiting who are not necessarily, in your area. How do you become successful in the service part of your industry? How do you, I just love what you do. You thought of an idea and you just ran with it. But now the other part that we never get taught, not just the business skills and the IT skills and the IP skills. How did you get your team engaged in the vision of what you're trying to create and provide the customer service that you require?
When I had the idea, it was one of those things to where you think to yourself, oh, do I need to go back to school and the traditional approach and get an MBA? And I just didn't really want to do that. I thought to myself, and I'm probably wrong, but I thought to myself, I think getting an MBA would look great in my resume, but I don't know for me personally if it would actually make that much of a difference from what I'm trying to do. And so I reached out to, I have some friends that had startups, and I reached out to them, and they just recommend certain books. Like, oh, this is a really good book. Read this book. And it was a book called Rework. And then there's some other really good books too, but that one really stuck with me. And then let's turn on to podcasts. Masters of Scale is a podcast by Reid Hoffman that I really love. And I think it's because it's a lot of stories of founders of how they started and the problems and the adversity that they faced and how they kind of persevered. And I just kind of gobbled that up and listened to probably one of those a day. And
wow.
yeah, and that was really it. And then I think if you're passionate about it and you really believe and you're proving that it works, then everything kind of is easy after that. All relative, of course, but now when I talk to physicians, and I'll reach out to LinkedIn, usually just use LinkedIn and look at see people who are, like, let's say, Epic certified, and I'll just tell them about my idea. I'll talk to them on the phone, and I don't know if they just kind of feel my passion about it, but they're like, this is a great idea. I'd love to do this. Yeah, sign me up. I'll send you my resume. And so that part has been very successful, getting Epic super users or certified users, Cerner super users, people just interested, because I think especially in the healthcare world, everybody knows this is a problem, and they wish they could help more, but they just don't have the right tool to help. And I think when you come in and say, hey, I've got this tool that's going to use you and your expertise and leverage you and help everybody else, everyone's on board for that. They're like, yeah, that's great. I'm all about it. sign me up.
Do you interview each service person, to make sure they have the right personality for the job?
I do, yeah, because I really focus on that user experience. So
Right.
I want to make sure that the how we have this set up is it's true peer to peer. It's that respectful,
Yeah.
conversation, and make sure that they're knowledgeable, so that they understand. And then that's also why we have a report sent back to the health system of how we answered the question,
That's so good.
because every organization is like, no, our build is a little bit different. And we can, I know this, I've been in several healthcare systems. I understand every, a Cerner isn't a Cerner, and Epic isn't an Epic. It's not like Windows and Mac. They're all a little nuanced, a little bit different. And so we make sure that prior to certifying that Evie, what we call them for as a support person, that they review the information, they're comfortable with it. We answer any questions they may have. They always have that information at their fingertips if they need it. But once they kind of go through that, then they're certified, and only questions will go to them from organizations that they are approved to answer for. But yeah, I always talk to everybody first, make sure they're a right fit, and because it's a big deal. It's my company. I want to make sure we have a great reputation, a great experience, and we're completely transparent with the health system itself.
Oh, you sound like a great leader, JD. How did you learn these leadership skills?
I think the hard way. Some people are just kind of born natural leaders. I'm not going to say that I'm a born natural leader at all. I think
I'm not
that
either, so that's okay, JD.
I do think that there are leadership skills that you learn over time
And
from
still learn.
experience. Yeah. Sometimes you learn a lot. I've learned a lot of what not to do,
Right.
and
What's that?
what a good leader is not.
Yes.
Um,
What are they not?
yeah, and
We're
so
winding this down, but I would love to hear what you say about that.
yeah. Well, I mean, the not things would be, in my experience, overconfidence and incompetence are a deadly combination. And I would say not just within the world of business, but also the world of healthcare. I mean, I'm sure you knew, had people in training where, there was that cocky doctor, and you're just like, oh, that person's going to hurt somebody. Like they don't think they're wrong when they're clearly wrong. And so it's really over time just learning what not to do, and then when you find something that is right, just not only do it, but make it your own, make it make it relatable, make it something that's where you can build off of that. And that's what I've always kind of done, probably ever since I became I don't know when it started, in my memory, maybe when I was a senior resident, when all of a sudden I was actually having to lead and train somebody. Your role kind of changes at that moment. You're like, oh, I'm no longer the person, the just
Learning,
a cog in the
following.
wheel here,
Mhm.
but I actually have to like train somebody and make sure everything's going right. And that's probably where it all started, but at least to my memory.
Thank you so much for sharing all this. How can someone reach out to you, JD, if they're interested in what you're offering?
Sure. Well, our website is www.justaskev.com, and email is jd@justaskev. And of course, I have my LinkedIn profile, and we have a Instagram because it's 2021 and you have to have Instagram, I guess. But other than that, yeah, it's pretty simple to get a hold of me. I'm completely available, and be happy to help any health system, large or small, in any capacity. We have the ability to scale small and big pretty quickly. And from my experience, I'm very budget conscious. I'll put it that way, because I know just how expensive it can be, and it doesn't
Oh,
have to be
how much
expensive at
does
all.
it cost, JD, approximately, or does
Yeah,
that
it
vary?
would. It depends if you're using it as a software as a service. That would be, we have kind of three models or three offerings. It depends on the size of your health system.
Okay.
But we also include what we call lifelines. And lifelines are literally, if you've seen Who Wants to Be a Millionaire and you get stuck and you have to ask a lifeline, that's what we call them. And that's what we have. And we throw in, depending on the size of your health system, we throw in the lifelines with that software as a service as well. That gives the organization the ability to either use those at after hours and holiday coverage, so they get true 24/7, or if they have a upcoming project that they want to, they can use them for that as well. And then we offer the lifelines themselves just at $40 a pop, and they can be used any time of the day, whenever you like. And then also you can buy enough lifelines and convert those over to a onboarding session. So for your physicians who have finished their training, but they before they go live that first day, we connect them with another fellow physician, and they spend like up to an hour with them and answer any questions they have, show them how to make a smart phrase or an auto text, how to make their favorites, how to make the note templates, make really kind of do that peer-to-peer connection of saying, oh, this is how you actually admit a patient. Here's how you do your orders. Here's your order set. Here's your admission note template. This is how you discharge a patient. And then if you have an ER doctor, then that's a different experience. So we say, all right, this is how you do when a trauma patient comes in. This is how you do just a regular sick visit. This is how you do, broken arm, all those things. They take them through that entire experience like soup to nuts, so that when they are on their first day, they are hitting the ground running from that point on.
Right. So it sounds like you have a whole varied platform of services available, depending on if you need it just once in a while or all the time, or for a big project. That's
Yep.
So
Yep.
Thank you so much for being here.
Thank you.
This is Dr. Elsie Coe with Lead Physician. If you're a physician or a leader who's helping physicians and can help us deliver messages out there through social media, I would love to hear from you. Please if you heard this and you really want to hear more. My email is info@drlcco.com. Also, my website is leadphysician.org. And we're starting our own online leadership program for physicians on January 26th. Please check it out. Take care, everybody. Happy Sunday.
Thank you.